Well, good afternoon. Hello, Eliza. Welcome to the university.
Hello.
So the question here is, a patient comes to you and they've got chest problems. They're coughing a lot. They're feeling short of breath. And as part of your investigation process, you advise that he needs a chest x-ray.
Okay.
But your patient is refusing because he believes that chest x-rays are harmful to his health. What do you do in this situation?
Well, obviously, you've got to take into account the patient's reasoning and opinions for why he's against it, because at the end of the day, it is his body and he gets the decision on what should be done to him. But then you could try look at alternative procedures that you could do instead of the x-ray to see if maybe the patient would prefer them and if they'd give the same outcome. But then you've also got to assess what it is that's wrong with the patient and whether the x-ray will give the best. Is it an x-ray?
Yeah.
If the x-ray will give the best thing, because you might not know what you're looking for and the x-ray might be the best use. You could also ask people in your team about what the best way to handle this is if you're unsure on what to do. You've got to be empathetic towards the patient's wishes.
All right.
Because x-rays can, with the whole UV lighting, which can be dangerous. So you've got to take that into accordance.
Okay.
Please can you read the question?
Of course you can. I'll even put it in front of you.
Okay.
There you go.
Then you've got to consider beneficence, because that's maleficence, to do no harm to the patient, especially with the patient thinking that the x-rays are harmful to his health. But then that links in with, I don't know.
It's okay. You're thinking about whether they're useful or not and patients' view on that, yeah? Is there anything else that comes to mind? No? Okay, no problem at all. So if you look carefully at the bottom, there's another question at the bottom which says, discuss patients versus the clinician's autonomy here. Do you think you can have a chat about that with me? So, what issues of autonomy come in from a patient's perspective and the clinician's perspective?
Well, obviously, the clinician's going to have more knowledge of symptoms like this because they may have seen similar cases with other patients. So that's why they might have thought that x-rays are the most beneficial to the patient to try and pinpoint what's wrong.
Yeah.
And it gives them a better idea, because if they've got the chest problems and the feeling of short breath, then chest x-ray seems like the best option to, because it gives you that part of the body.
Okay.
But I don't know.
No, sure, it's okay, no problem. Did you mention something about the patient?
Well, the patient might be in distress because, they've got these symptoms.
Yeah.
So they might just be panicking, and then that might be impacting their autonomy to make the decision.
Got you. Yeah.
So that's why they may be overthinking. If they take the chest x-ray, then that could make whatever they've got worse. And
Okay.
Side effects.
Okay.
No, I'm done.
Yeah, you're done. Okay, thank you very much. Thank you. That was a good effort. Brilliant. Okay, so Eliza, that was a decent attempt. What do you feel about it? What are your thoughts?
I don't think I ticked off many of them.
You don't think so?
No.
Okay. Do you think you have done some of that?
I think I've done considering like the patient's perspective, the doctor's perspective, the organisation, and then some of the ethical ones. And then I think I've included the empathy with considering like the patient's point for why they don't want it.
Absolutely. I think sometimes we can be a bit harsh on ourselves when it comes to self-criticism, but you did touch on quite a lot, to be fair. And I think that would be classed as a pretty good answer in an interview, but I think what we're trying to do is here find excellence in our answer, don't we? How do you think we could make it a more excellent answer?
I don't know.
Should we ask the guys in the background, see if they want to come in and give some feedback? How do we make this a more excellent answer, guys?
So maybe I think look at how severe it is. So for the X-ray, is it something minor, something you can maybe check another way, or if it would just go away in a few days, or is it something major again? So if it's something major that needs to be detected right now, the doctor could maybe explain it to the patient just to make sure they're not scared. They might be anxious about it. It might not be as big as it is. So really try to understand and see it from their point of view and see where they're coming from and why they don't want to do this and try to explain it.
Could you also see then the time frame, like for how recent and how long, like the time frame of how long the patient's been dealing with the symptoms?
I suppose you can think about how would that help in this scenario. There's a reason why you're thinking about the timeline.
Because could that tell you how, I don't know what the word is, but how like dangerous it is, like how. I don't know the word.
How significant it is.
Severe it is to them. Life.
Okay. I'll take on board.
I'd say like potentially, exploring this sort of stigma or like way of thinking that they've got around X-rays. Why do they think it is dangerous? Maybe you could explain the process a little bit better to them so they really understand what's going on and how it works. Potentially sort of explain to them like explore why they think that it's so dangerous and sort of
absolutely
reassure them about that fact. And like it's it's very routine for people to have X-rays. It's very common. It doesn't unless you're going under a lot of them, you won't be exposed to very much radiation at all. So if that's what you're worried about, then there's what we could potentially find maybe more significant than the actual damage of getting this X-ray. So it's important to consider that.
Yeah, absolutely. Empathy is a big part of this question, isn't it?
Definitely.
You've got a situation where there's essentially a conflict going on here, isn't there? The doctor wants to do an X-ray. The patient doesn't want to do an X-ray. And it's how we kind of overcome that conflict. So there takes a lot of understanding, empathy. There's an undertone of that throughout your interaction here. So as always, I always say, don't jump into these scenarios. Don't panic. Take a breath. Take it nice and easy. In terms of summarizing, if it feels it's useful for you to do that, so my patient doesn't want an X-ray because they think it's harmful to them, and I think they should have it. Some difference of opinion there. A summary like that I think is useful. And absolutely, as you rightly say, from an empathy perspective, let's think about what our patient is thinking here. Why do they think it's harmful? Is it because indeed they've had a bad experience? It might not be themselves, it might be a family member or a friend or somebody. They may have read something in the rags, and there's some mention about cancers or something coming from X-rays. as you rightly mentioned, James, it's high doses of X-rays that can cause cancers, but they might not know that. So is it a case of understanding what their fears or concerns are and see if we can reason with them? Is it that their reasons are actually well-founded? They may have some genuine concerns, or they may have not so genuine concerns, but concerns that you can't allay easily. And so you have to consider other options, like you rightly said. Can we do a CT scan? Well, that's more X-ray, perhaps. Can we do an MRI scan, which is magnets? Can we do an ultrasound, which is based on sound? So there may be another way of doing this that he's more amenable to.
Yeah.
So exploring our patient. You also kind of hinted on something which I quite liked here, is your patient, because the scenario doesn't really say how old they are. You know, have they got capacity? Can they consent? Are they a child? Are they an adult? It's worth registering that as a fact. Okay. If they aren't able to consent, why is that? Is it because they are temporarily incapacitated? Do we wait for them to develop, consciousness, or do we think, well, they're not going to be able to decide themselves, so maybe I need to speak to dad, or maybe I need to speak to husband, maybe I need to speak to sister. I don't know, depending on what the circumstances are. Yeah. So there's some big C's there.
Yeah.
Really, from our perspective, isn't it right that we keep an open mind about this, that we are non-judgmental about this, that we are exercising some, fair ethics here, in that, yes, there is an autonomy that the patient demands, and that's right, but are they able to? Do they have capacity? Are they able to consent for themselves, or do we need to involve other people and seek their autonomy over this issue? Is there something about our autonomy as healthcare professionals in trying to do the right thing? Because sometimes it might be a case that we overrule and the patients and actually follow through because we think it's the right thing to do. I think you raise a valid point about the carer, about the family, in that, do they have a view on this? Can we involve them to help us? Or actually they might shed light on why a patient has negative views or certain view on things. Could be religious, could be cultural, we don't know. So it's so important to look at it from different perspectives. So I don't think we can quite say that the person should definitely have an X-ray or not, but what we can work with them. And that might then result in an X-ray happening. It may also result in an alternative happening, or we might have to concede that an X-ray doesn't happen at all, and for that matter, anything else.
When you asked about the so there's like it's the consultant versus the autonomy of the patient. How would you have approached it? Like, how would you have answered it? Because is it like either one could be right just with a correct justification, or would one answer be like more right than the other?
So it may be a situation where through reasoning you find that your patient's willing to come along with you because you've managed to allay their fears, their concerns. It's all about empathy, isn't it? It's all about communicating and making sure you get to an end point, and making sure they receive the information in the right way. It's certainly not about forcing an issue. So having explained everything, having translated everything, having communicated all the facts and figures about this, your patient may come along with you. They may not. They may still stick to their guns and say, no X-ray. In which case, we might have to respect their wishes. It could be a 93-year-old lady who says, look, doctor, I've had enough. By all means, give me an antibiotic for my chest, but I don't want to be checked for other things because I've had a good innings. I'm quite happy. If I die, I die. Can you do much to force her? Probably not. You're right. Ariane, you're right, because she can justify her thinking. I don't want an X-ray. Yeah?
Wait,
I don't want an X-ray.
Can you just say that, like, say at the end of the day you decide that you're not going to give the X-ray because of the patient's wishes? So could you say that you just give them some medication to relieve their symptoms?
Yeah. Yeah, we do that. It's not unusual at all, is it? Keeping somebody comfortable. People said, I want non-invasive treatment. I don't want too much hassle. Give me some antibiotics. Give me some medicine to help relieve my symptoms. And yeah, I might turn a corner and get better. I might not. But it's my choice. And I've got capacity and I can consent. Yeah. Brilliant. Thank you very much.